A warm welcome to all the participants for the second edition of Healthcare Insights, powered by RedMed, LBN Tech Solutions, and All Ladies League Digital Marketing Chapter. I am Kumar from LBN Tech Solutions and All India Chairperson for Digital Transformation, All Ladies League, and your host for the evening. Welcome to all. We all know lab tests and the reports play a supremely important part in diagnosis. I once asked a lab technician whether he loves the work he's doing. And he replied to me with a smile saying, yes, he loves his job and that his work is super important. And without his report, the doctor would be only guessing the diagnosis. I suppose it is so important these days, the test results, the lab reports. And today's session title is to test or not to test diagnostic labs for you. And we have our esteemed expert speaker with us to talk on the above topic, Dr. Pasupathi Siva, Medical Technology Industry Advisor, ESI MedTek Solutions. Welcome, sir.
Thank you.
He is a seasoned professional with close to 30 years of experience in leadership positions in the core areas of healthcare, with specific expertise in clinical diagnostics, established an extensive network of relationships across various verticals within the healthcare industry, reputation for integrity, work ethic, industry competence, and goodwill towards the team. We are so happy to have you at this session, sir, and like me, I'm sure the participants have lots of questions regarding various tests. And this session will be moderated by Mr. J. Srinivasan, founder and CEO RedMed Health Systems, where he focuses in enabling affordable preventive care that promotes wellness, early detection of chronic disease, and prevention of infectious diseases. Welcome, Jay. So I invite you to take over the session. The floor is all yours.
Thank you, Meghalai,
for that excellent introduction. Welcome, everyone, to the second edition of Healthcare Insights, sponsored by All Ladies League, LBN Technologies, and RedMed Health Systems. Healthcare Insights is a monthly webinar that is scheduled for the last Saturday of every month. So you might want to mark your calendar for subsequent webinars to follow. My name is J. Srinivasan, and I will be your interview host this evening. Our guest today is Dr. Siva, an individual with specific expertise and experience in the diagnostics industry. He has a PhD in biochemistry. Siva, in fact, can lay claim to being one of the pioneers in the emergence and growth of central labs in the country during his over 30 years as head of the diagnostic divisions of various MNCs, when he was instrumental in giving birth to the core business model that underpins all central labs. Today's conversation is titled, To Test or Not to Test. And despite the obvious reference, we'll take a decidedly non-Shakespearean look at the industry and seek to demystify what is in reality a complex industry that often puzzles more often than it explains. Our task today, not surprisingly, is to lay bare and explain things in a manner that all of us can understand, appreciate, and take useful takeaways from. Let's get going. Siva, at the outset, a hearty welcome and best wishes to you.
Thank you, sir. Jay.
You're welcome. We are privileged to have you here today. You and I have had long conversations on these and other similar issues. And we have a lot of questions, especially from the audience. So I'm going to start you off with a few basic ones, lob a few simple balls at you across the net, and then we can get going on a better tennis play during the course of this conversation. In healthcare, we often hear of the phrase preventive care, secondary care, tertiary care. We also hear of diagnostic tests. Could you give the audience a bit of understanding as to what these mean, so that they are able to when they meet their doctor or go to a provider, they have a better sense of what to expect at each of these places?
Okay, thank you, Jay. Thanks for this important question before we discuss about to test or not to test. Okay, at the outset, I would like to thank Meghalai, Sandhya, and yourself for giving me an opportunity to talk about this topic, which is very, very important. And unless we understand some of the basics, we will not be able to understand whether it is important really to go to the lab or not. So that is why what I have done is to help myself and to help all of you. I will give my answers through some small, a simple presentation or slides. I'm not going to review a presentation or make a presentation to you, but I will use these slides to help you understand better of what I am talking. So, Jay, you have asked me about preventive care, what does it do, etc., etc. Okay, as we all know from our childhood, we understood that prevention is better than cure, right? There are two aspects to our lives. One is preventive care and another is sick care. Sick care is something like damage control. Like when our car goes bad, we are stuck in the middle of a highway. Then we have to call a mechanic, get it fixed, and then drive forward. So that is, I compare it to the sick care. So you go to a doctor only or test only when you are sick. So this is kind of damage control. Okay, that is relatively managing the sickness of an individual. Whereas preventive care is something called as wellness. So you are proactively creating a real health and preventing a disease. It is like, preventive care of your car, monthly maintenance or a quarterly maintenance or a periodical maintenance check of your car, where you take the car and then do regular maintenance. And then, what happens is the car is always running smoothly. And that's why, our body, when we compare it to a car, it moves smoothly. So that is the difference between, I'm sure you all clearly understand this now. Then, very importantly, we also have to understand the different components in the overall healthcare continuum. Okay, that would answer some of the questions that you have asked. If you look at the healthcare continuum, it involves 4 key elements. One is prevention. Second one is diagnose and follow up. This is part of an effective care. And third one is treatment. So once you prevent, ideally you need to prevent, that will lead to healthy living. And then, something happens, it is diagnosing and following up. And the fourth one is treating. In doing all this in the healthcare continuum, there are multiple stakeholders who are involved in it. It could be the pharmacy, it could be the primary care center, it could be specialists, it could be hospitals, it could be the different health plans that we take. And I'm consciously making this statement about laboratory in the end, because laboratory also plays a very, very important role in the healthcare continuum. I hope I have answered the questions that you have asked, Jay.
Okay. So, Siva, there are 2 aspects that you brought up. One is the notion that when we are sick, we go to a doctor or we go to a hospital. And then you talked about the continuum. Before we delve into the continuum aspect, I wanted to roll back to the aspect of sickness, because that is something that most of us easily understand. There are 2 contexts, at least, that I can think of that people interact or engage with a clinician or a doctor. One is if they're really, really sick and they have to be admitted to a hospital.
Yep.
And the second one is every time we have a fever or a cough or a sore throat or an indigestion, we go to the clinic and we see a doctor and he looks at you, he uses his stethoscope, and then he gives you some prescription. You go and buy some medications that he or she has prescribed. You pop it and you forget about it.
Yep.
So obviously, between these 2 poles lies a whole range of possibilities, number one. And if you look at just these 2 poles, the idea of good health or prevention, as you say, actually lies outside of either of these, correct?
Yeah, absolutely.
So how would a simple episode, like going to a doctor for a very simple thing, and that simple thing could be an accident, such as a fracture. It could be taking care of your tooth. It could be a fever or whatever. Where does that fall in the context of prevention? And is it something that also inserts itself within the family's notion of good health?
Okay.
Because infectious diseases obviously falls within that context as well, right?
Exactly. So there are three things, Jay, that you have spoken of. One is somebody getting into an accident and then, getting himself fractured, and then he has to go to, there is no choice. So it is an accident, then one has to go to the doctor. That's one part. The other two important thing is when you have an infection, and second thing is you do not have an infection, but still you are sick. So there are two types of, these are the two critical components of our disease state. One is a non-communicable disease, another one is a communicable disease. Communicable disease is all infectious diseases. For example, flu, dengue, malaria, these are all communicable diseases. These are all transmitted from one person to another, either through a vector or it is normally done. Okay, that is something that we need to prevent using vaccines, you taking proper care and avoiding the vectors. Say, for example, in case of dengue and malaria, avoid the mosquitoes, and how do you eradicate that? That is one program. In the non-communicable diseases, we are the people who are responsible for it. Okay, how are we responsible for it? Okay, the basic thing is our erratic lifestyles. Nowadays, most of us are always glued to the computer at least 10 to 12 hours in a day. We are stuck in front of the computer. Our sitting postures are not good. And then, the way we sleep is not correct. And then, we watch TV sitting on the, lying down on the bed, etc., etc. That is, one is postures. And second thing is, erratic lifestyles, work pressure, too much of, especially I'm seeing it currently during the pandemic. Most of the people are working from home, and they are ending up working for 14, 16 hours a day, and then there is no right amount of sleep, and they are not able to eat right time, and then they do not have the opportunity to go out and expose themselves and socialize. So work pressure is another thing. And third most important thing is irregular eating habits. There has to be a consistency in how you eat, what you eat, and what does it contain. These are all the factors that are contributing to the lifestyle diseases, which are heart diseases, obesity, diabetes. See, there are three critical areas where one has to look at the non-communicable diseases. One is diabetes, second is cardiovascular diseases, which are heart diseases, and third one is diabetes. So what is the consequence of this? The consequence of this, if you look at the right side of my picture that I am sharing with you, 50% of the beds in India are occupied by the people who are suffering from lifestyle diseases. You imagine if we had kept our lifestyle properly, if we would not have fallen sick, we would have relieved those many beds, and then that would have been made available to more needy people. India is already struggling in terms of number of hospital beds, number of nurses, number of doctors, all these things. So this is something that I would say that, lifestyle and the other associated things are causing to this non-communicable diseases.
Okay. So from a public perspective, there are two types of diseases. One is infectious that we hear and read about, and we often get affected as well. Dengue, malaria, chikungunya, all that falls within that category, which you are saying we have very little control over. And then there is a set of diseases which you call non-communicable diseases or lifestyle diseases, where we are very much in control if we choose to have control.
Absolutely.
Okay. That is interesting because those seem to be the kind of diseases that are largely hidden, right?
Yeah.
I mean, not every one of us lands up in a hospital and occupying the beds, but they are being occupied by a good segment of the population.
Correct. At least the statistics show that 50% of the beds are occupied, which I'm not very surprised to see that.
So how, when they land up in the hospital, what are the manifestations? What are they there for to get treated for?
They are there for heart diseases. For example, you eat high fat food, you do not exercise, and then what will happen is it could lead to some cardiac problems. People will end up having cardiac complications, and then they need to go for angiogram, angioplasty, bypass surgery. Everything could be the manifestation of that. Or somebody is a smoker, constantly smokes, his lungs are affected. He could be admitted because of a cancer, cancer of the lungs, or if somebody chews pan or some tobacco, they would have a oral cavity cancer. So these are all related to the lifestyle. Smoking is also a lifestyle activity, right? So that is how it happens.
So are there any forewarnings? I mean, if somebody out there among our audience today is listening to you, and they are hearing you say that we are ourselves responsible through our lifestyles, by our choices that we make every day, in predisposing ourselves to some incidence of future non-communicable disease, which will land us in a hospital. But are there any forewarnings before they go from the home to the hospital?
Yeah. So more than the forewarning, it is the care that you need to take. That is where I said that, car maintenance. You have to go take your car for a periodical servicing or preventive checkup. So similarly, your body also has to go for preventive checkup. See, we have spoken about the risk factors like, unhealthy diet, very poor physical activity, air pollution, tobacco, alcohol. These are all the things that are the common risk factors. There are also underlying determinants like, global urbanization, aging, people increasing. And then there are, these are all leading to diseases like cardiovascular, cancer, diabetes, which I told. What are the interventions? How you asked me the question about what is the forewarning.
Yes.
Forewarning is preventive care is very, very important. Risk factor control and screening is very important. So that is where your screening periodically for any of the underlying complications could be done apart from your own intervention in terms of behavioral changes. Now, who is responsible for it? If you look at the right side bottom portion of the picture, I have very clearly stated that it is the individual who is responsible. Whereas the other two components like lifestyle interventions and then environmental factor, it could be government and society, those. But here, prevention and risk factor control it is we who are responsible for that one. I hope I have answered your question.
Yes. So is it being done in our Indian healthcare today? We started out by saying we visit the doctor when we are sick in some form. So if you don't have visible evidence of those kind of sicknesses and irritable stomach or a fever or something like that, what is it that we should seek that will enable us to get those periodic screenings that you are talking about? Is it being done?
See, education
doctors give that periodic screening.
It is a question. See, not only in countries like India, even in developed countries, If you ask me, do they follow? I would hesitate to say yes. Okay. I think, we are all the same, whether we live in the US, Europe, or in India. But awareness is one of the key factors. Why are we having this kind of a seminar? The thing is that, we want to understand that it is very important to have this kind of a thing. So it's very, very important that awareness has to be there for each individual. It is much better than what it was several years ago, but people are becoming more conscious and they are doing more exercise and they are trying to be conscious about their diet, etc. But however, there are certain things that we need to do. Okay, so the preventive care, that is the periodical servicing of your body, happens through certain kinds of actions that you take. So you go and get your body evaluated for your health. Okay. So then, you can see if there is a symptom that is there that could be immediately, you can nip it in the bud itself. You don't have to allow it to grow further and become more serious. Then, when you do this preventive care, it also will help you to diagnose early and get the treatment. And then, as I said, that serious health problems could be avoided. And it will give you an early warning signs, especially cases like cancer, right? So cancer is also a non-communicable disease. It is also associated with our lifestyle. Yeah. So, of course, yes. So early warning signs could be coming. And who will do this? What does it include? It could be an immunization, like we are all waiting for COVID immunization, like that, immunization, physical examination by the physician, and the lab work and the X-rays. Okay. See, the objective of today's talk was to see what is lab and how it works. This is where it comes in, right? Lab work and X-ray. And then these will all depend on the age, gender, and overall health status of an individual, etc., etc. So I personally divide this into two aspects. One is a physician's office service, and second one is a laboratory health service or a laboratory screening. Okay. In case of physician's office, it is a routine physical examination. If it is a baby, baby care and immunizations. Whereas in the lab, it could be a blood test, it could be a mammography, it could be a colonoscopy, it could be a cervical cancer screening, or whatever cancer screening, and osteoporosis screening. Vitamin D. If you take out today, evaluate 100 people, test them for vitamin D. Significant percentage of the population would be having much lower levels of vitamin D than what is required. And that ultimately...
That is very interesting. We live in a very sunny country, and I believe vitamin D is largely comes from standing in the sun, right?
Sun, yeah, that's right. But
and we still have vitamin D deficiency is what you're saying.
Yeah, absolutely. So
Why is that?
We think that, we are exposing enough to the right kind of sun, but I think, we are all again, our way of working, sitting inside, confining ourselves to an air-conditioned room and with less amount of exposure to the sun. So this happens. I myself have got a lower vitamin D deficiency. So I recently figured it out. So we need to... Again, at the end of the day, what will happen is we try to pop in a pill for it. Okay. The pill does not come just with vitamin D, but there are a lot of excipients in it. That would all have a side effects on your body. It could lead to further complications. So avoid taking medicines. If somebody is there from the pharma industry, they may not like what I'm making or the statement that I'm making, but ideally, yes, you should try to avoid medication and prevent taking medication.
Okay. So, Siva, you spoke of periodic screening and periodic tests. Can you give us an idea of what these tests are and how often an average person or an average adult has to go through these tests? Because we hear of, every time we take an insurance, they say master health check, annual check. Yeah. Does that qualify for the kind of test that you're talking about?
Yeah, to a large extent, yes, we need to get certain types of tests done, but it is also becoming very commercial. Okay, I do not. I give a disclaimer saying that I don't mean an offense to anybody who runs a lab or a laboratory chain. But I think, we are drawn by the fact that an X laboratory does 199 tests for 1,000 rupees. Another lab says that we do 100 tests for some 500 rupees, things like that. Are those tests really important for us? Do they form the real requirement for us? Now, we are all attracted by the number. The bigger, the better, right? That has been the psychologically distinct, but it does not work like that. You need to, there are simple tests that are required, which you do very regularly. Again, I compare it to your car servicing. Sure. What do? You go and do oil change, you go and do filter change, and you will ensure that some filters are clean, period. That is enough. Rather than that, if you will not change the whole engine, you will not change multiple things and everything. So that's how it works. So there are certain tests that need to be done periodically and for certain age group. So in the next 2-3 slides, I'll explain those things, Jay, so that people are clear about it. Okay. As we said that diabetes, cardiovascular, and then the other NCDs, lung diseases, cancer, these are all form of the non-communicable diseases. This could all be come from unhealthy diet, physical activity, smoking. We spoke about this. So what do you basically screen for regularly? Okay, the healthy screening. This will be the real lifesaver for us. Okay, what do you do? So there are certain specific tests for men. There are certain specific tests for women. That does not mean that women should not get the tests that are done for men and vice versa. So it's very important. So basically, broadly, if you speak for men, prostate cancer screening. Okay, in men, prostate cancer is one of the common forms of cancer. So this is one test.
Any age at which one has to take these?
I'll come to the age and then what tests to be done specifically at what age. I will come to you in a minute. And the second one is blood pressure. Third one is lipids. Lipids includes your cholesterol, triglycerides, and HDL cholesterol. HDL cholesterol is the good cholesterol. You need to have significantly higher amount of HDL cholesterol. Normally, many of the people who are not healthy will have lesser amount of HDL cholesterol, more amount of bad cholesterol, which is total cholesterol. Okay. Then blood sugar is another very important, which causes blood sugar, diabetes. So this is for men. In women, very specifically, 3 important things need to be done. Okay. Apart from several other tests. One is the pap smear. Pap smear is a periodical check that needs to be done for cervical cancer. Then mammogram. Mammogram is for the breast cancer. So you'll have to periodically check for it. These are 2 common types of cancer in women. Whereas prostate cancer is one of the, prostate cancer and colon cancer are more common in men. And then the other important test is the bone density screening for the osteoporosis, etc. Women are more susceptible to osteoporosis and then those kinds of things. So when you look at those things, I have broadly spoken of what are the categories. And if you recognize the picture that is there on the left side, which I spoke in the earlier thing, there are different components that are associated with a patient. One of the key stakeholders in this is the laboratory. Okay, very, very important part is the lab. Okay, this is where the diagnosis happens. Okay, what do they do? And the common terms that we are, I have gone for diagnosis, I have gone for blood test, I gave a sample. Okay, you just now said complete body check. Okay, that an X number of tests in a particular package. And then, the common other terms that we do is where do we go? Diagnostic laboratory, pathology laboratory, Then a lot of people say pathological laboratory. Pathological laboratory is not a correct term. Pathology lab is the correct term. Okay. Medical checkup, home collection, X-ray, ultrasound, MRI, CT. So these are all the things that involve parts of the testing. So let us see what is a diagnostic laboratory. Where are they located? How reliable are they? Which one I need to go? Is it reliable or not reliable? How frequently do I need to get it done? Okay. What is the reason why I should get these tests? I think, we will address some of these things in the next couple of slides. I'm not going to read any of these things, Okay. What is the laboratory? So first question is what? Diagnostic laboratory, what? Diagnostic laboratory is a place where tests are done on clinical. The clinical specimens could be your blood. Either it could be sputum, it could be urine, it could be stool. Okay, so these are the specimens that could be. And what this place does is it will get the information about health of an individual in the form of diagnostic results. Okay, which would help in treatment and prevention of a disease. So that is what is done in a laboratory. Okay, what is the aim of this laboratory? The aim of this laboratory is to ensure that the doctor can decide whether you have a disease or not, whether it is X, that is plus or minus. If you don't have it, it is fine. If you have it, he will take the decision accordingly. So this is primarily an evidence-based diagnosis or evidence-based therapy. Unless you have a problem that is appearing from the diagnostic test done, you would not get into a therapy. So that is what does the lab does. The last thing is, what are the departments in the laboratory? A lot of people say, no, I got my urine culture and sensitivity done. Urine culture and sensitivity done is in the microbiology department of the lab. Okay, protein, sugar, and cholesterol are done in chemistry of the lab. You have CBC, which is hemoglobin, blood platelets, and then those RBCs. These are all done in hematology lab. So there are different things in the lab. So this is what concerning what. So then the important question is, where do I go? This is very, very critical. Okay, you are today confused every day along with the newspaper. If you are still buying a hard copy of the newspaper, there are so many flyers that is coming in. We will do so many tests at such a price, whatever it is. So you are confused. I just want to give a statistic to the audience that there are about 100,000 labs across the country. It is estimated that 100,000 labs are there. That is 1 lakh labs are there in the country. Okay, and most of these labs are either in urban or semi-urban geographies. That means majority of the population, that is 70% of the population who live in rural areas, do not have access to the diagnostic services. Only 30% of the population have access, and majority of these 100,000 labs are accessible to the urban population. That does not mean that there are no labs in rural areas, but they are small, very, very small quantity.
Sorry for the interruption, Siva. Quick interjection here.
Yeah.
So when you talk about 1 lakh labs across the country, you are including both small hole in the wall kind of things we see on every street, as also the very big ones, which are either standalone or inside large hospitals, correct?
Absolutely. Yes, right. To understand it very clearly, I will share a picture in a second. But, out of this, what is important, Jay, is that whether these labs are certified or not. In India, any of the people who are in the audience or myself or yourself can call it a Siva Diagnostic Laboratory. You can just open it in your garage and then do it. You don't need a certification, or you don't need a regulatory approval to start a laboratory. That is
really?
Yeah, that is the sorry state of. Yes, as of today, there is no regulation.
I can go in and set up a lab tomorrow.
Absolutely no problem. You can. All you have to do is you have to employ a postgraduate in science who can sign your report, or sometimes no more recently they have said a doctor can sign a report. That is it. Other than that, anybody can open a lab.
So how is a citizen to know whether they are going to a good lab or not? I mean, I'm sure you have pointers to that.
Yeah. If you look at what kind of laboratory should I choose, I should choose a lab which is certified, where it is called as an accreditation. Certification is accreditation. Accreditation.
It's voluntary.
Yeah, it is voluntary. So a lot of people who have taken the accreditation, they will have the necessary quality processes established. And then the results coming out of such labs are reliable and ensures that the results that you are getting are more accurate. And that does not mean that 100% of the results that come out of accurate, but to a large extent they are accurate. So out of 100,000 labs, I am very sorry to say that hardly about 1,000 labs are accredited. Rest 99,000 are not accredited. So this is,
okay.
Please, all the audience, hold your heart. This is what it is. This is a very, very interesting factor.
Very troubling statistic.
Very, very troubling statistic. So this is what it is. Okay. Then the other important point that comes to your mind is, where do I go? How do I give the sample? Okay. Do I go to a laboratory, walk into a laboratory and give my sample, or do I go to a collection center, or is there a home collection facility? All things are available. There is a lot of facility. There are a lot of facilities now. You can have a facility of having the home collection, laboratory collection centers. That's all good. Okay. So those kinds of things are improving. But this is what is about. I hope I have answered you about where do I collect. This is the picture that I wanted to share with you. On the left side of the
is what we are used to seeing everywhere.
This is what it is. Those are all diagnostic labs. The 6 are diagnostic labs, mostly in the rural areas. That does not mean that all of them are in rural areas. There are some in cities also. They all claim to be fully computerized clinical laboratory. Okay, I do not know. It looks like a pan dabba for me, and then still the guy runs a lab and claims itself to be a computerized lab. So you can imagine what kind of quality that you get it. Okay, so if people who are from the rural areas are listening, where do they go? On the other hand, the organized laboratories, okay, have got high-end labs, very high-end equipment. Majority of the work is done by robotics. Lot of automation is involved. Sample collection process. So there is a system, and many of such labs are all accredited. But the cost of doing the test is higher here. So this is where you'll have to be very careful about choosing the laboratory.
So I want to pause you here, Siva.
Yes, sir.
There are a couple of things that are very troubling when I hear you say all these. Let me extract 3 things from what you have just said in the last 10 minutes. The first is, you said people have to do screening tests periodically. And then you describe the kind of tests by gender and perhaps by age. At what point does a doctor insert herself so that the right tests are taken? Or are there tests which does not really require a doctor intervention, and one can choose to make our own decision to go to a lab? That's number one. Okay, because there seems to be a gray area of where we go. Obviously, some tests are going to be much more complex, much more disease specific, and obviously that has to come from a doctor. And yet others, from what we saw in one of your slides, could be a decision that a reasonably intelligent person can take. So that is number one. Number two, you mentioned way in the beginning, was that there is a tremendous competition in the lab arena in the country, where they are selling packages of various types. 199 tests for so much, and another lab will give you half that many for 1/4 the price, and so on. So there's a lot of competition there, and selling these things like any consumer product. So that's the second one, which consumers are being assaulted with, these advertisements that you mentioned in the newspapers and on TV. The third thing I want to bring up is your last point, which is that there are over 100,000 labs, of which less than 1,000 are accredited, and the accreditation is purely voluntary. So if you bring all these three ideas together, we are looking at a very competitive market. It's like going to a vegetable market and saying, I want 1 kilo of potatoes, I want half a kilo of onions, I want something like that. And people are going to be induced by that assault on your years of price. Okay, there's a competition. The second thing is you don't know where to go. And the third thing is you don't know for what do I need prior permission or prior assent by a doctor or some clinician, right? Could you clarify those three issues?
Yeah, one is whether you need to get the doctor's approval or prescription to go for a test. Second thing is about the accreditation. Third thing is that these different kinds of lab where competition is there with respect to price. Okay, am I correct? Did I understand this?
You got it.
Okay. Yeah. In terms of going to a physician, it is if you recollect few minutes back when I said, I think it is always good to have a family physician who would monitor you once in a while, and it need not have to be every time you take a package test or bunch of tests that you need to go to a physician. No prescription is required for doing these packages. First, okay. Let me tell you, anybody can walk into a lab and say that I want, unless it's very specific, like, kind of COVID testing that we are doing, you need to have those. Otherwise, anybody can walk into a lab, and then it is called as a self-prescription kind of a thing. So you can get your test done. But it is always important to visit a doctor after you get once you have to decide whether, depending upon the age, how frequently you need to visit a physician. That answers that part of the question.
Sure.
Second thing is, in terms of the accreditation of the lab and which lab to go, I think one needs to be very, very careful in identifying the lab. Personally, if I have to do my test, I will consistently maintain one laboratory so that, they use the same technology to do it, same kind of a principle on which they do a particular test. So my comparison between my previous set of results and these results are relatively, you can compare them. Otherwise, I do a test in a lab in one place and another lab, another technology. The normal ranges could be slightly different. All these things. So it is not necessary or mandatory, but ideally I would stick to the lab, or I would stick to the lab chain or individual lab that I go normally, if as far as possible, stick to that.
Because of standardized processes, standardized training, and perhaps the same equipment being used for the same tests.
Exactly, same equipment, principle on which the test is done, etc., etc. Okay. The last point is in terms of pricing. I think it is, at least if you go to a vegetable market, the 10 different vendors would have almost similar prices. Whereas here it is not like that. I have put an example slide subsequently. You will see the pricing varies very, very erratically. And then, we are confused, all right, because of this. So it is better to agree with, ideally a good physician will say, you don't need. For example, 2 days back, somebody in my family got a bunch of tests done from a lab chain. So they have done about 120 different tests. Why do you need zinc? Why do you need selenium? Why do you need so many tests? Those are all not even needed. This is only to psychologically put the patient to attract him. Okay, you come to me, I will do this. Many of these tests are calculated parameters also. Because if they do 1 or 2 parameters, there are 3-4 other parameters could be calculated. For example, if you do total protein and albumin, okay, you can calculate globulin. Total protein minus albumin will be globulin. Okay, so but still it will be shown as 3 tests that done. So similarly, if you do cholesterol and triglycerides, you can do VLDL, very low density lipoprotein. So like that, there are tests that there are a lot of calculated parameters. So I think, it is very important to know what tests are done. If you are doing a preventive check, try to stick to those tests. And if there is a variation, your physician will pick up and he will tell you if there have to be any additional tests that have to be done, and go to the lab and get those additional tests done. Unnecessarily getting done too many tests is not advisable. I don't think it is over information, not required, and unnecessarily confuses. People will get confused. Okay, a particular parameter where you are not even concerned, if it shows high or low, then you get worried, and then you get into some kind of a psychological trauma. Okay, so it is better to stick to those things.
So how do people gauge the reliability of a test? So they've gone to a good accredited lab. They've gone on the prescription of a doctor, of their GP, for example. They get back the results, and the doctor is able to say you are either above or normal or below normal.
The physician,
at the end of the day, we want to know, was the test reliable?
Yeah, the physician will determine based on the clinical observation. That is where you need to go to a doctor. Okay, so physician will say whether, okay, if your sugar is like very normal, but you are showing lot of clinical symptoms that show that you are diabetic. So then he will say this result is good or not good, or he will ask you to repeat the test. Those kinds.
I see. So the reliability is based on a physician's judgment of your state of health.
Sometimes, yes, yeah, that's right.
Okay. What if that state of health is not really visible?
I think that is something that you have to trust the doctor, you have to trust the laboratory, and then that is where you choose a lab which is accredited, which gives a quality.
Is there something else? For example, in these reports, we see a range for many of these tests.
Yeah.
Right? Does that point to reliability?
No, range is, suppose if your blood sugar range is 90 to 110. Okay. If the blood sugar is anywhere between 90 to 110, this is normal. Okay. This will all taken into consideration into factors like technicians, minor errors, the sample drawing errors, preclinical errors. So the pre-analytical errors, those are all things that are taken into consideration and then given. So generally that is okay. Okay, that is not a problem. So yeah, let us move on, Jay. We are
sure thing.
At 20, so we have few more things. Right?
Okay.
Okay, what are the tests then? Which are the tests to be done? Okay, ideally this is enough according to me and according to several studies and several recommendations. Ideally, as a preventive care test, these are the tests that need to be done. Blood pressure, which is not invasive, which could be done by anybody, so you can get it done. For diabetes, you should do HbA1c and blood sugar, blood glucose. Okay, I will talk about HbA1c later, but this is one thing. To ensure that your kidneys are okay, you should get your blood urea and blood urea nitrogen, that is urea, and then creatinine. Electrolytes is to check your mineral balance. Cholesterol is to check your fat content. These are all chemistry tests, so these need to be done. Then in the urine analysis has to be done, which will tell the condition about your kidney. Then if you come to the cancer screening, okay, when we talk about the frequency, then you will understand it better how frequently it is to be done. Every quarter these need not have to be done. Mammogram, abnormal growth in the breast. Okay, women after a certain age have to undergo this. Pap smear, it is a cancerous possibility in the cervix. So cervical cancer, pap smear is to be done. There is a huge taboo in India that they do not want to go. The sample collection is an issue, and then that kind of a cultural issue is there. So, but that has to be kept aside. One has to take care of her health. So it is very important that this pap smear has to be done. Men prostate test, like there is a specific test called as prostate specific antigen that has to be done. Occult blood test once in a while has to be done for the large intestine, mostly in men. Okay. So these are the tests that need to be done, and this is an important which you have been asking me from the beginning. What are the tests? And these are all recommended by Government of India. Okay. CGHS recommends these things. So for both men and women of different age groups, I will not go through all the age groups and all the men or women, but I will tell. For example, somebody who is in the age group of 40 to 59, at least definitely have to get it if he is supposed to be normal. If he is normal and if there is no complications, definitely the complete blood count has to be done, which includes hemoglobin, total blood count, ESR, etc. come under that. Urine examination, blood sugar and HbA1c, lipid profile, which includes cholesterol, triglycerides, etc., urea, creatinine, and X-ray test. In contrast to that, if somebody is 80 years old, a man has to do all these things, he has to do an ECG and PSA test. Okay, PSA is prostate specific antigen. When you come to women, you can see X-ray test is there, but they have to do, even in the age group of 40 to 59, X-ray, ECG, mammogram, pap smear, and pap smear or HPV test. These need to be done. So these things are very, very clearly mentioned. I think, if anybody wants, you can share this. This is a very, very important information. Again, some of this could be modified depending upon the physician's recommendation.
Okay. Siva, I want to pause for a moment and speak specifically about diabetes. Let's take 2 minutes on that, because India apparently is the world's capital for diabetes today. And there are several tens of million people who are diagnosed with diabetes, some who are in the pre-diabetic stage, and some who are at risk but not diagnosed yet. So how often does one test for diabetes, and what are the tests available? Could you quickly, 1 minute, dwell on that?
Two key tests. One is blood sugar, that is the blood sugar test. Second one is HbA1c. Okay. I think blood sugar test is it is needed, but it would tell. It could depend on several external factors. If I have taken high content of sugar and get it tested within a period of time, it might show well. Or tomorrow morning I have a blood test, I have to do blood sugar. Since previous day evening itself, I will not do anything. I will do exercise and then give my sample. My blood sugar will be low. So you are cheating yourself. So blood sugar is an indicator, but it is not the whole and soul. Will give you very clearly whether it is you are really a diabetic condition or not. But what is important test that has come up more recently, I think it has been there for about 15 years now. 15-20 years, it is called as HbA1c. That what it is. HB means for hemoglobin A1c. Okay, I have shown in this picture on the right side. Red blood cells are there. In the blue dots are blood sugar. In the blood, the blood cells, red blood cells, RBCs, constantly come in contact with sugar, and they bind to the RBCs. Okay, then that is how HbA1c is formed. If your RBCs are exposed to more and more amount of blood sugar, the concentration of HbA1c will be higher. Okay, This depends, and this HbA1c value is generally given in terms of percentage, and it gives you, this value gives an average 3-month value. Okay, you cannot cheat here. It is impossible to cheat this test. Okay, and it does not need a fasting. It does not need a fasting sugar. It could be done anytime, during the daytime, you can evening, while you go for a walking in the evening, you can go get it done, or when you are shopping around, you can get your HbA1c. HbA1c values are very clearly given here. If the values are less than 5.7, it is normal. 5.7 to 6 is pre-diabetes, and 6 and above is diabetic. And then, again, physicians will determine when to put a person on medication or not. This is described here. Well, I want to have specifically added the right side of the diagram is diabetes is one of the key parameters that need to be tested. It would affect every part of our body. It could lead to stroke, it should lead to retinopathy, it could lead to heart diseases, it could lead to kidneys, nephropathy, neuropathy, nervous disorder, vascular diseases, everything. So it is very critical that one has to do the diabetes. I hope I have answered your question.
Oh, very much so. And speaking of cardiac health, heart health, since that is also something that is very prevalent today, what are the easy tests, periodic tests that have to be done, and how often?
Cholesterol, triglycerides, and HDL cholesterol are the 3 critical tests that need to be done. Okay. That will, and apart from that, ECG is another test that could be done. So even though ECG will not give a condition that of a heart ailment all the time, all heart ailments do not necessarily give abnormal ECG. But ECG is also a good thing. See, I want to bring you very quickly in half a minute. I want to talk about this. Does it not sound complicated, confusing, and complex for you? This test. A laboratory A gives a package of 59 tests at 8,000 rupees, 63 tests for 8,085, and laboratory B gives 56 at 750, and the same lab gives a package at 4,000 rupees for 106 tests. Look at the third lab, 749 rupees for 51 tests, 75 tests for 1299. Last one is package 45 tests is 2,240, 46 tests for 4137. Is it not confusing and complex?
Yes.
It is? Yeah. So this says it all. This is what it is I was talking about. So there is no need for, why do you need an iron test? Iron test is not for everybody. Physician will recommend iron. Liver test is not needed as part of your check. It could be done only when the doctor requires. Okay. So this is what I wanted to show you in one single slide. I hope I made it very clear.
Very clear, very clear. We don't have a lot of time now. Before we open up to the audience for questions. And I want to change tracks to something else that is very much front line and center today all over the world, and which is COVID-19, coronavirus. Right? Yeah. Now, there is a lot of news about a lot of things about coronavirus. About the infection rate, about the recovery rate, about the fatality rate. So those are about the infections. And then there are a lot of news items about the tests. There are rapid tests, there are genetic tests. And then, of course, lately, in the last couple of weeks, we have started hearing news about the possibility that we may have a vaccine. And I know by reading the media that there are a lot of vaccine candidates out there. How soon they would arrive in the Indian market, we still don't have an idea. Could you shed some light on the totality of this and what is it that we ought to be doing?
Yeah, thanks, Jay. Asking this is something that has interested me in the recent times. So I thought that, I would be more than glad to help give few very quickly, in 5 minutes time, I will explain all these things.
Thank you.
Okay, SARS-CoV is the COVID-19. Okay, that is the one which is causing the corona pandemic now for us. So there are three different types of tests that are there. One is a molecular testing, another is antibody testing, third one is antigen testing. So what does it mean? I think, everybody has become a professor in test. All of us, by watching at the TV, reading on YouTube, and then newspapers, there is so much of information bombardment that we are all fairly aware of it. But still, in order to explain in a simple way, I have made a few slides so that I could explain this. So the molecular testing is the testing of the molecular, the RNA of the virus. The COVID-19 virus is an RNA virus. There are two types of genetic material. One is RNA, another is DNA. RNA is a single-stranded, DNA is a double-stranded. Okay. So the molecular testing will detect the current state of infection, and it detects the RNA in the body, in an individual. It is done only in nasal swab and throat swabs. That is molecular testing. I will explain in detail about molecular testing in the next slide. The antigen testing, I'll skip a bit and then go to the antigen testing. Antigen testing also does for the current infection. It is also taken by the nasal swab or a throat swab. It detects the protein that is formed out of the virus that is formed. See, the protein, the RNA molecule that converts into a protein, and that protein that is present in the body is measured. So this is current infection. So that is current infection is molecular testing and antigen. And antibody testing is if somebody has got infected and he got cured, and then the body will have developed the antibodies against the proteins that have been made by the virus. So the antibody will determine the antibody's presence. If you have an antibody, the possibilities of getting further infection are minimal. I'm very careful when I'm making statement because this is a new virus. It is in the early stages. We do not know, but it is minimal. So then are you able to see? Is there an echo?
One moment. Yeah.
So in the RT-PCR testing, what happens is the nasal swab is taken and then the RNA is extracted. I told you that single-stranded, double-stranded. If you see here, this is a single strand, this is a double strand. This RNA, they will do a backward procedure called as reverse transcriptase. That is what is meant for RT. It is not rapid testing. It is reverse transcription. Reverse transcription, it forms the DNA, and the DNA that is formed is multiplied, made many photocopies of it using a technology called as polymerase chain reaction, and that DNA is measured. The more the amount of DNA, that much will be the viral load in the body, and it is present. If you see the person
who has already been infected,
he is currently infected. The virus is presently in the body. If you see in the picture, it is very clear here. Viral RNA, viral antigen. You see this, and I have put an arrow also. So this is molecular testing. I think that is enough to know about molecular testing. And then in the rapid antigen test, it is a simple short time. The molecular testing will take about 2 to 3 hours to complete a single test. Whereas in the rapid antigen test, it is faster. It can be done in 30 minutes. The swab is taken, it is put in a solution like this, and then the sample is mixed in the solution, and it is put on a card, which is something similar to the pregnancy card, and put on that one. It will give 2 lines. One is a positive line and another is a negative line. If both the lines are present, that means the antigen is present. And if only one line, test line is present, the control line is present and test line is not present, that means it is negative. Okay, but this is not very sensitive. It is significantly less sensitive than rapid molecular test, and if it is negative, it could be a false negative also. That means that somebody who has less amount of the antigen, and if this test is not recognizing the antigen and still the individual carries the infection, he still is susceptible to transmitting the disease to others. So what will happen is he is a false negative. So such kind of false negatives to be tested. This is a big discussion that is currently going on. Some states are doing large number of rapid antigen tests, and then they are saying that we have done enough number of tests. No, but still the infection rate is high in those states. So this is rapid antigen test. Rapid antigen test is okay, is a quick test, but it is not as accurate as the molecular test. Okay. Now let us come to, this is a very, very important test, antibody test. It is still not prevalent because we have not reached the stage where we have to use it effectively. It could be done with just a simple 1 drop of blood. Okay. If you look at the progression of the disease, by the 7th day, the body starts developing an antibody called as IgG antibody, and it sustains in the body for a long time. The green line. The red line is IgM antibody, which will be there for some time, and it will go off after some time. Okay. So sorry guys. So this will go off. So ideally, these two are antibodies. That why do we need this to test this? If you have already been infected and cured, if antibodies are there, that means you are fairly well protected. This is an effective tool for surveillance and epidemiological studies. And also, it is a very, very critical thing to issue an immunity passport. I foresee that most of the governments across the world will start introducing the immunity passport. Few years back, when some of the countries, if you have to travel, you have to have a hepatitis certificate and also HIV certificate. Similarly,
and all that kind of stuff.
Exactly. So similarly, they will ask for an immunity passport, and when you have to do an immunity passport, you have to do the antibody test. These could be used anywhere. It could be used in prisons, airports, in railway stations, bus stands, municipal bodies, government agencies, primary health clinics, everywhere it is used. So this is, yeah.
Siva, I have a question here. We are not at a point where there is a vaccine. So the only options available to us is testing for the infection, coronavirus, right?
Yeah.
And what you have just explained is there are many varieties of tests, 3 types of tests. So how does a normal average person choose a test, or a more common scenario is where the municipality decides a test has to be done in your locality or in your apartment complex? How do we react to this? Because we obviously have different ways of testing, and from what you have explained,
okay, so
tests which are not so good versus tests which are
I understood that. Okay, you have no choice in deciding what test to do. It is the government that will decide. Every single test that is done has to be recorded, especially the antigen test and the molecular test has to be recorded, and it cannot be done without your Aadhaar card or some document that is there. Okay, so the choice is not for an individual to decide whether what type of test you want to do. You have to go through one of those tests. Antibody test is something that comes later in the, so that is why antibody tests are available. There are available on instruments, certain kind of instruments, and also on the rapid cards. But they have still, need for doing that extensively has not yet come. Okay, it will come very soon. Okay,
is that a function of community? What is that? What is a? I'm searching for a word.
Community body. Yeah.
Yes.
I think it could be a requirement, right? The government regulatory requirement, whatever it is. So that will happen. So The last point that you have asked me is about the vaccines, right? Okay, this is an important picture, and this I think this needs to be. A lot of people have heard about herd immunity. What is herd immunity? Multiple people go there and one infect the other, and then everybody develops antibodies, and then everybody becomes immunized. Okay, that is herd immunity. What are the consequences of herd immunity? Consequences of herd immunity is there could be loss of life, and many people could get because they have comorbidities. A lot of mortality rate could be very, very high. Okay, so that is why in order to avoid that, we need to have vaccination. When you vaccinate, more and more people, say for example, in the blue color, everything is nobody is immunized and they are all still healthy. So we are like us. If we have not got the COVID, then if even two people are there in such a community, they could infect so many people. It could spread from one another. Okay. But what will happen is in the second stage, some antibodies will develop. Some people have the immunity and they have developed the antibody, and then they will try to minimize the spread of virus. And in the third case, when vaccine or herd immunity happens, more and more people will get it, and these red dots will become significantly lower, and they would not have a scope to spread, and they will kill them. The virus gets killed itself. So this is something broadly that I thought I would explain. Yeah,
excellent explanation there. So when we hear, which we have been hearing oftentimes in many cities, that the municipality has tested, and some person has tested positive, and they do a repeat test. A week later, it comes out negative, right? What can be the cause of these things? Because this causes a lot of angst among the population, that they came and hauled me away and tested and said I have positive, and so I was quarantined, and then they did a repeat test and I'm okay. Now, obviously, there's something wrong there, right?
Either the guy was tested in the later part of the infection, and then he showed positive and he became negative. Okay, what is important is 2 weeks later he has to get tested for his antibodies. If he has antibodies, the first test is correct. Okay, if the first test was inaccurately given as a false positive, and the subsequent testing was negative, I think there is an error in the way the testing was done. So this is all complex. How many people go through this? It's difficult to difficult to say.
So, Siva, we have come to the end of our questions. You have walked us through a really good set of issues that comes up when we go to diagnostic labs for testing, and what are the issues there, and when do we go there, and what are the kinds of tests and things like that. So it has been very illuminating at this point. Sandhya probably has a few more questions from the audience right now. So let's bring her in and see if there are any further questions.
Sandhya, please come and take over the Q&A session. Sandhya is the founder of WikiWare and co-founder of RedMed, and also the All India Chairperson for Startup Support Group, All Ladies League. Sandhya Rao, over to you for the Q&A session, and participants, you can type your questions on the chat box, or you can unmute yourself and ask too. We have about 15 minutes. Yeah, go ahead, Sandhya. Yeah.
Thank you. So I think the first question, which you have already answered, but I still will read it out, is if no health issue, then what tests should people above 50 do, and how often?
Yeah, this is, as I have said, if it is no health issue, simple diabetic test and the lipid test like cholesterol, triglycerides, and for the kidneys, urea, creatinine. Okay, these are some of the simple tests that need to be done, Sandhya. Yeah.
Okay, thank you. For diabetic people, how often do you suggest an eye checkup? This is from Sendal Kumar.
Well, generally it is once in a year, definitely. Okay. Otherwise, as recommended by the ophthalmologist. Okay. If the complication is more severe, they go more often. But otherwise, once in a year as part of the overall checkup, it is better to get the eye check done. Yes.
Okay, so since we are looking at questions from Sendil Kumar, he's got two
Yeah.
more. One is, certified labs give the normal range for HbA1c for a diabetic to be greater than 6.5. But I think your slide showed from 6 upwards. So what is this difference
Yeah.
here?
If you have heard me carefully, I have mentioned that sometimes it is decided by the physicians based on how it is done. Okay. Some people call it as between 6 to 6.5 is also pre-diabetic. Okay. After 6.5, they say diabetic. So some people say up to 6.5 is diabetic with no medicine, controlled through exercise and diet. And after 6.5, you have to have medication. So that is where it is very important. After your value is touching 6, it's very important to go to the doctor, discuss with him, and if he suggests any additional tests, do it, and then go for medication or no medication. Hope I'm clear on this.
Siva, this is Jay. Quick question on in the same vein. This is actually an issue that came up even in our last webinar, where one of the questions related to these numbers. At that time in the last webinar, it was relating to blood pressure. 80 or 120 or 80 is considered to be the normal. But at the same time, all of these numbers for ranges typically come from studies which have nothing to do with the Indian population, right? They have come from largely a Caucasian population, the studies, unfortunately. So to what degree do these numbers actually refer to Indians? And can there be a degree of variance in acceptance of these ranges?
There have been no normal studies done in India as far as I know. Okay. When I was also managing some of the diagnostic businesses, we wanted to attempt to do even at least for glucose, creatinine, and urea. Okay. Unfortunately, these numbers are all still, we are inheriting it from those things. So it's a big topic, Jay, and there are experts on this who will be able to answer better. But I think that we don't have, these ranges are not our Indian population ranges.
Okay. Thank you.
There's a question from Malika Swaminathan saying, can you suggest some accredited laboratories in Chennai where in-house GPs are available or is available for follow-up review of the test reports?
I do not know whether in-house GP is available or not. The good labs are High-Tech Diagnostics, Ehrlich Laboratory, Metropolis, Lister Metropolis. These are all some of the good labs or reputed labs in Chennai. I am not sure whether they would have an associated physician or not. Newberg Diagnostics is another. Ehrlich is now Newberg Diagnostics. Yes.
Thank you. Lakshmi wants to know if you can provide clarity of hypothyroidism. If the TSH levels are 8.5, does the person have hypothyroidism?
It would not be fair for me to comment for professional reasons on specific numbers, and then I can only say that hypothyroidism means your body is not able to secrete enough of the thyroid hormone that is required. And that is where many of us will take the thyroxine or L-troxine or whatever, Tyronorm or L-troxine, a certain value depending upon. This is a parameter which fluctuates quite a bit, and it needs to be stabilized, and various doses are. So the physician is the right person who will be able to tell this. And I am not a physician, so it would not be fair for me to make a statement on that.
Thank you. So,
I joined Dr. Sivakumar sir. I'm a pathologist.
Okay.
From Chennai, working retired from government service, now on with the NABL accredited lab, Belroth Hospital. I'm a pathologist. Whatever you said so far, I really thank that you have highlighted about the accreditation of the laboratory services to ensure quality of the reports. And vice versa, you said the clinician has to decide about the features and result in the further investigations. That point I really appreciated. And as you mentioned, the clinician should provide us enough parameters or clinical orientation for us to come to a conclusion, and I help them also in arriving at the diagnosis. I appreciated your talk, a very good, even for a lay person, there's a very highlighted topic, and I'm thanking you for the wonderful lecture, sir.
Thank you, doctor. Thank you very much. Appreciate it.
Being a pathologist, I have undergone so many accreditation and now the CAP accreditation. Keep on doing this evaluation of the quality.
The country is short of accreditation auditors, doctor. I think you need to replicate quite a few of them.
Yes.
Like the DNA replicates on a polymerase chain reaction, you should put in more and more auditors so that country will have better labs.
Yes, sir. Yes, sir. You have rightly said.
Yeah.
Thank you so much, doctor, for that.
Thank you.
Thank you.
Thank you.
So there's one more question about, again, suggestion of good labs in Bangalore.
Anand,
madam chose the words. Exactly. The one and only Anand Diagnostic.
Anand Diagnostics, yeah, that is our lab too. So Ravi has a question saying, for Indian population, normal values vary from the American and European population. So why is it that why is ICMR not coming up with values for Indians?
Okay, so it's a very complex study. Actually, it is not as simple as that we take some 1,000 results and then put statistical significance and arrive at a normal range. India is in itself has got 36 smaller countries. Different genetic descendants are there. Multiple sects are there. The population in Northeast is quite different from people in the South. So if you look at India, has got multiple countries within itself. So lot of attempts have been made by many of the. There is a very prominent biochemist by name Dr. Pasupathi. He was from he was an ex-professor of biochemistry from CMC Vellore. Okay, he is a pioneer in quality control in India, especially on the biochemistry. Many attempts have been made. They have not been able to get into that. See, the moment you do it, it is a mega study. I really agree with the fact that the government should take it up at some point of time. Right now, going on. But I think it is a very good idea that India should. And it is also not cheap. It is very expensive study. It would involve millions of rupees, millions of dollars in order to conduct such kind of a study and arrive at the thing. And then the private industry also should aggressively cooperate. More importantly, many of the instruments that are supplied for the high-end laboratories are all from the multinational companies. They are not Indian companies. So for them, the contribution of the revenue coming out of India is less than 2% or 3%. Why would they invest in a normal range study for a country like India as against several other countries where they are doing? So this is also another point. This is a very, that is why when Jay asked me this question, I said it itself is a 2-3 days seminar where we need to discuss about this normal.
So, Siva, quick interjection here. This is Jay. I asked that question because I've been interested in this for a long time. And just to answer to add to what you said to the person who asked this question, to Ravi, it is not just India. The same kind of regional or racial parameters specific to a particular geography or race, you can extend to Southeast Asia, to the Far East, to South America, to Africa. None of the numbers exist for any of these populations. And part of it is historical, that a lot of these life sciences companies actually originated in the West and had a 150-year run in the West with Caucasian populations. So we are looking at a mix of economics, sociology, politics, perhaps, in clarifying this issue. So it's not just an Indian issue.
Yeah, absolutely. Agreed.
Thank you. Thank you. So two more quick questions, I think, before I hand it over back to Meghu. One is there an alternative test for angiography?
Angiography. I think there are certain CT related tests that are available. That those could be done, but angiography is so far the best one for the cardiac blocks, identifying the blocks in the blood vessels. Yes.
So the second one is a thing that is really of concern, in the sense that all big labs have collection centers, and so the values of the results may vary due to uncontrolled transportation. And your comments, and as a part of that, could you also talk about point of care tests which companies do? They come home and test your blood and other vitals.
Oh, very good. So it gives me an opportunity to say the excellent innovation done by RedMed. Okay. RedMed has been working very hard in terms of integrating the point of care devices with the digital technology, so that the results could be measured, the test could be done at the point of care, and result could be transmitted to the physician, so that the concerns about transportation of the sample and the sample getting spoiled and the results could be erratic can be avoided. So that is yes, point of care. That is what is going to be the future, especially after this COVID pandemic. What will happen is people are scared of going to the labs. People are scared of going and visiting physicians. They are scared of going to the collection center. So they either want the home collection phenomena, or they want a point of care test to be done. So point of care test is one of the most aggressive business strategies that are being looked at by the diagnostic companies as well. That answers about the point of care test. Sandhya, with respect to the question on transportation of the sample, this is another topic. I do not want to offend any of the lab chains or collection centers, people who manage collection centers. This is a big cause of concern. The sample has to be transported in a particular way, and it should reach within certain time. And then if it does not reach within time, the value of the results could change. For example, the simple test like glucose, the moment it is collected, it has to be done within a certain period of time. Otherwise, glycolysis will happen. The values will change based on how much time the sample is exposed. So it is very important that the lab chains that are transporting the samples use very effective methods of transporting in the right temperature conditions, and properly ensured that there is no hemolysis of the sample. Lastly, there are certain labs which will collect the sample in the morning and they reach the lab in the night. They go by air or by road or bus or whatever it is. The values are that's it. I don't want to answer beyond that. That is what it is.
Thank you. If you have any more questions, Dr. Siva has shared his email ID and contact number. Meghu has just put it on the chat sometime back. You can reach out to him directly. Thank you. I will hand it over back to Meghu now. Thank you, Meghu.
There is one question, Doctor, which has come to me. Is it possible to share the PowerPoint presentation?
Sure.
Some people find it very useful, and it is like a keepsake kind of document where you can refer. So if anybody wants that, then I think you can just type email to me. If you email to me, I can just distribute it to.
Yeah, I will send it. I will send it to you and Sanjay in a PDF format, so that you can circulate it.
Sure. I have just put my email ID there. So if you want it, you can just email. Email to me, and I will email it back to you.
Okay, ma'am. Thank you. Thank you.
Thank you so much, Doctor. And Jay, that was wonderful moderation. It was very enlightening for all the participants. And I think it is time to close, although there is so much to talk about. It's an ocean by itself, this several webinars, which will run into several webinars. But we have to call it a day, and I invite Pramila Jain. Pramila, are you there? She is the founder of Candy Floss, a digital branding company. And I invite her to give the closing comments. Pramila? I think she has dropped off the call. So Jay, I hand it over to you. You can sum it up.
Yeah. Can you hear me?
Yes.
Yeah.
Siva, this has been one wonderful webinar. A lot of very useful things to take away. Many things that we take for granted. And coming from an expert like you to understand what the issues are, what the real issues are, how to sift through the many dimensions of doing a test, and how to go about ensuring that the tests we take are indeed accurate and reliable. So a lot of information from you, and we thank you wholeheartedly for your time. You've spent a lot of time with us today, and it has been absolutely fabulous. Thank you. And Meghalay, it has been, once again, a standard performance from you in hosting and getting the show off the ground and running. So thank you. And Sandhya for pulling up those questions from the audience. So thank you one and all. And to the audience, it has been a privilege to have you all today. And hopefully you will join us again. Like I said, we have this webinar series once every month on the last Saturday of every month. Look forward to seeing you there. Bye-bye. And
thank you. Thank you all. Bye. Bye-bye.
Thank you, participants. And see you all on December 26th with Dr. Monica Suri. She will be the expert speaker there. She is a nutritionist. So all the details will be there on the LBN Tech Solutions Facebook page. So please log in and check it out. See you all next webinar. Thanks for participating. Thank you, Dr.